Gentlemen, on with the program.
Hi, I'm Dr. Lisa Hernandez, and I'd like to welcome you to Your Health television program on AMP Cable Television Channel 24 and on the web at ampmedia.org. I will be your host, and my guests will be giving you valuable information to help you improve your health. Today, my guests and I will be commemorating the 30-year anniversary of the first reports of the Acquired Immunodeficiency Syndrome, or AIDS. And my guests will be making reflections from the field, as they are the individuals that were in the front line of the HIV/AIDS efforts here in Monterey County. In June of this year, we commemorated 30 years of the first reports from the Morbidity and Mortality Report, Weekly Report, or MMWR, from the Centers for Disease Control, or CDC, that described pneumocystis carinii pneumonia, or PCP pneumonia, in 5 homosexual men in Los Angeles. And this was the first time that AIDS was documented in any of the medical reports worldwide. A month later, that same MMWR report described additional cases of opportunistic infections and pneumocystis pneumonia in other homosexual men in New York City and other parts of California. And these reports were sentinel reports for a pandemic that had expansive effects on the worldwide. Since then, in the United States, over 575,000 Americans have lost their lives to AIDS, and more than 56,000 people in the United States each year are diagnosed with human immunodeficiency virus, or HIV. And currently we have over 1.1 million people in the United States with HIV, and 20% of those people, of that 1.1 million people, don't even know they have that infection. So even though we have the knowledge and the tools to control HIV, and we'll talk a little bit about that with our guests today, and we have the tools to improve the health of people with HIV, we have a lot of work to do. And part of that is the troubling reality that people's sense of urgency in the last 30 years basically declined or waned. And there's data from certain reports that show that in 1995, 44% of the general public in the United States indicated that HIV/AIDS was the most urgent public health problem facing the nation. In 2009, only 6% of people feel that way. So that is a troubling reality in my mind. Today we're going to speak with 3 guests involved in HIV efforts here in Monterey County, and have them reflect on how HIV/AIDS efforts have evolved over the years from their perspective. My first guest is Suzanne Moreno, and Suzanne is a licensed vocational nurse in the Monterey County Health Department Communicable Disease Unit, and she has worked in the health department for over 31 years. She first started in field nursing and worked in the public health clinics, and then when the HIV/AIDS epidemic became an issue, a public health concern, she became an HIV/AIDS testing counselor. And she was one of the first individuals in the county to do testing for individuals requesting HIV test. And she worked at one of the first sites. So I want to welcome you, Suzanne. Thank you. So my first question is, what are your first memories of HIV/AIDS? And you can answer that from a personal perspective or professional, or both.
Personally, because it was advertised so that it was a gay male disease, I just felt it was something far away from me and would not affect me. And then because it was a larger issue and research and testing became about, it became part of me because of my work in public health and being a counselor and a tester in our clinic sites.
And how do you feel most people felt about the HIV virus or AIDS in the community?
To me, it was something hidden, something not popular, because it was something only happened to people that were engaged in homosexual activity. And it wasn't, this was before they realized that it was blood, you would catch it from blood, so blood transfusions and things. Then it was for, it was something that was also affected certain people that had had surgeries and hemophiliacs that received blood products.
So in the early years, because there was still a lot of information that was unknown, people had different ideas and kind of filled in the blanks.
Correct.
So if we fast forward to a couple years after that, so we first learned of AIDS in 81. In 85, we were able to develop, or the FDA developed the first test for HIV. What was the health department's response to HIV and AIDS after that test was developed?
There was funding, state funding, that enabled local counties in the state of California to obtain a support to offer these tests for the community, and Monterey County did that because the test became available sometime in the summer, and by late summer, early fall, we had a clinic set up, and we were offering the anonymous testing for free and in our county.
So how was that test performed?
It was through a blood test. Okay. Is the way they were detecting the HIV virus in the person's system. So a blood was drawn. And
these test sites, were they part of the clinics that were already established? I mentioned that you were part of the STD, the sexually transmitted disease clinics, and IZ clinics, immunization clinics. Were these the same clinics?
At first, it was a separate clinic so that we could see as many people as possible. So they were by appointment, and they were in our satellite office, and then we had offered it in our main office in Salinas. First, it began in our satellite office in Seaside. We began small, and as the demand was needed, they increased to, I can remember being 2 days a week, every week in Salinas by appointment, and that was in Seaside, and then in Salinas, we offered it 1 day a week, all day. Then within probably a couple of years, we were also offering it as part of our service when we had our STD clinics. Okay. That was part of that.
And so you weren't the only test counselor. There were a couple other individuals as well. So.
Yes, almost all our clinic nurses at the time were trained.
Okay. So it sounds like you could be busy at times. And how often did you have a positive result? And actually, before I asked that question, once you tested someone, what was the procedure? How soon after someone's blood was drawn did you get results back, and then and were able to speak with those individuals?
The turnaround time for a test would be a minimum of 2 weeks. So we usually have you return in person, because this was an anonymous test.
Right.
2 weeks from that. So when you finished your appointment, you'd make a return appointment with the clerk, and return on that time, and you'd have your results ready. I probably, because I was one of, at the beginning, say 3 nurses working clinic, I probably gave a couple of positive results a week. I'd have to look back at statistics, but we had quite a few people coming in. And, some days there was more than that. Some days there was several. It just depended on, who was coming in testing.
So what kind of responses did you see when you gave that news of an HIV diagnosis?
It varied from people being shocked to people realizing that They assumed it was going to be positive because possibly a partner was positive, or they had been informed in some way that, to be tested. And then some people did, were shocked.
So it sounds like you never knew what people were how they were going to respond. And I always think about, giving that news, and most times it seemed like it was bad news, and it could be a stressful situation for you and your colleagues. What kind of support was there for you with being able to kind of deal with having to give those types of results to folks?
Well, at that time, in the mid to 80s to late 80s, it just increased. Once people knew the testing was there, there was an increased demand, and we were very busy, and it was, I feel, stressful. Our director of nurses saw the need and would talk to us and provided counseling for us. We had confidential counseling, group counseling, and if we needed one-on-one, we could get that through our health department services, through behavioral health. We had one of these psychiatrists lead a group, and it was very confidential and private, so it did ease because we could talk about things there that stayed in the group, and we were helped quite a bit because it could get stressful.
Yeah. So you mentioned that some people came in to get tested because their partner asked them to get tested because of maybe a knowledge that they were HIV positive. What were some of the other reasons why people came in to get tested?
Some of the other reasons, worried well. This was a new disease out there, something that we didn't have all the answers for. So some people in our community came in because, hey, what if it wasn't just from what they're telling us in the news? I want to get tested. I want to be sure. I don't want to harm my family, my loved ones. A mixture of those types of reasons were other people who knew their activities, or maybe because their sexual activities weren't that out in the open, they came there to be tested also, to know they knew what they had been doing. They wouldn't always share that information, but it seemed like everyone had a good reason to be there.
So did you feel that the folks did have a better or good understanding of how the virus was transmitted then?
No, not always. Not always. Just like I said, worried well.
Right,
People
right.
would come in because they who knows? It might be, the wrong information might be out there, so I want to be sure. And that's why. And at that time, we take time to provide pamphlets that, as much as was known at that time, and verbally explain things to people. There may have been times when people felt, well, I don't need the test, but still they'd come in, get the education, get their questions answered.
Oh, okay. So what were some of the messages that you gave some of those folks, whether they tested or not, in terms of trying to keep their risk behaviors down?
Well, exactly that. Talk about risks that we knew so far. Talk about our health, and not talk so much about percentages. I mean, we need percentages in order to get funding and things, but just look at yourself and what are you doing and what are your partners doing. Stop and talk to your partner before you engage in intimate activity where there's going to be exchange of body fluids, and more we're finding out specifically what body fluids were passing the virus, etc. So you need to be aware of, like being aware of your surroundings. You need to be aware of your partner, be aware of what's going on, what you're doing, and how the spread is of the virus. So
I kind of am reading into what you're saying, but some of it could be also that what what risky behaviors you're engaging in is one thing, but also your partner's risky behavior is another thing that you have to take into consideration before engaging in sexual encounters with that person. So,
yes.
So that, I think that's probably a new thing that people were learning.
Correct, because with the pill, people weren't having to be as careful again with the exchange of body fluids and stuff. There was some diseases that people were getting, but this was something that was incurable as far as we knew, and it still is.
So I'm getting the time flag, so I have two questions. One I want to ask you first because I think it's a really important one, and then I'll throw in the other one as a bonus. But what do you see has changed today, or has anything changed today in how people, especially the younger generation, view HIV? Has anything changed? Has anything gotten better or worse?
What I currently do, I do STD investigation, and I see young adults, whether they are as young as teenage age or in their 20s and 30s, the change has not occurred. They're feeling that, you know, they're young, who cares, I'll take care of that, that's only for older people. And there's not that much about HIV and AIDS out there with the media, with education. I think that is really making them stay safe, because if they're getting other sexually transmitted diseases, they're also picking this, they can pick this up, that has no cure. There's time, again, lots of times when I do the interviewing, I'm on a specific disease, I'll ending up with, yes, HIV, there is no cure for it. There's young adults that think there is.
Mm-hmm. Yeah, I think that's something that we've seen, is that we've forgotten, and especially the younger generation has never seen someone with full-blown AIDS.
Correct.
Because we were in the field when we were caring for folks that didn't have access to the medications because they weren't developed yet. So, Suzanne, thank you very much.
You're
I knew
welcome.
we were going to run out of time.
Oh, thank you for having me.
But I want to say thank you again, and hopefully we'll come back to this another time. But we're going to take a short break. I'm Dr. Lisa Hernandez, and this is Your Health television program.